Ladies and gentlemen, welcome to the 5th Pharma CEO Breakfast, brought to you by the Budapest Business Journal and our professional partners, Phoenix Pharma. We're going to move straight to the round table, so I would like to invite our panelists to come up to the stage. We are delighted today to have two regular guests, two return visitors to our roundtable, and two new ones. So hopefully it's a start of a long and fruitful conversation and relationship down the line. We'll start. I don't have to reintroduce Ágnes to you, but I will anyway. So our keynote speaker, Ágnes Galgóczi. At the very far end, we have Dr. Judit Bidló, Deputy State Secretary for the Professional Management of Health at the Ministry of the Interior. And I think this is your third or fourth time speaking with us, so fourth at the minimum. She remembers them, each and every one, etched on her memory. Thank you for coming back, for continuing to come back. Next to you, and also actually, this only really works as an exercise in trying to exchange ideas if we have the involvement of government bodies. So we continue to be really grateful for the fact that you do come back and you do listen to the moans from the audience and indeed respond to them. Next to Judit, we have Dr. Katalin Szalóki, who is the CEO of the Association of Innovative Pharmaceutical Manufacturers, AIPM, in Hungary. And who's equally been here at least 3 times, I think. Then, obviously, we have Dr. Ágnes Galgóczi, and nearest to me, Dr. András Süle, who is the Chief Pharmacist at Péterfy Hospital and Outpatients Clinic. The names in Hungary are always so long. But that's just, something for me to worry about and complain about. Where do we start? Well, the second last slide kind of went really to the point of the first question I wanted to ask. So I'm gonna change that very slightly because I think it's it will be very helpful if we start with some common ground as to we can establish where we are and where we go from that. So what I want to start by doing is asking you whether, in principle, we think it's a good idea to extend these services to the pharmacies, and then we can begin to talk about the practicalities of how we do that. András, you're nearest me. Let's start with you. Is it a good idea? Is it something we should be pursuing?
Well, you're asking a pharmacist, so my answer is a most definite yes. From how I see it, and it might be a bit of an...
Sorry, if I could just say, if you could,
sorry.
as close as you can, thank you.
So it might be a bit of an instrumental bias with me, so I'm the proverbial man with a hammer in his hand who sees nails everywhere, But I do think that the frontline roles of pharmacists in patient care, let that be in primary care, namely vaccination, medication reconciliation in the community pharmacy setting, or other clinical pharmacy services delivered in hospitals, long-term care facilities. This bunch of new roles is, I think, the best possible outcome, not only for the profession, but also for the pharmacist. And I would frame it from the point of view of access. It is more or less a rule of thumb that pharmacies within the European Union see 8 to 10% of the population every day. Wow. So that means approximately 45 million pharmacist citizen encounters in the EU. In Hungary, it's around 700 to 800,000 pharmacy visits each day. That is a coverage of approximately 5 times more than the GP network, which is an immense access not only to extended services, for example, but not limited to vaccination, but also a vast possibility for us to inform and educate the population and our patients. And the other angle, besides this proximity of care and this access to high-level and curated healthcare-related data, would be, from my end, actually the safety aspect. Medical professions are so much diverse these days, and they are so much specialized in even subspecialties of nephrology, subspecialties of oncology care, which is the way things develop. But still, there has to be someone who is in charge of the person and not the individual disease. And mostly, even today in healthcare, we do cure with medication. And that medication does not magically appear by the bedside of the patient. So someone has to be in charge, and it is my argument, at least, that that person should be the pharmacist, as we are trained for that for a couple of years at the university. So it's a safety angle is, I think, equally as important as the proximity of care. So we can do the medication reconciliation, the medication history, medication review, and even from the hospital discharge point of view, that is a handover procedure for the primary care level, and that could also be in contact with how we curate the data that is being constructed during the healthcare service.
The data is really interesting, and we'll come back to that. It's been a recurring theme in all of these round tables. Agnes, it's perhaps a silly question to ask you because you've just given us a presentation, but presumably you think that this is a good idea, expanding out into the pharmacies.
Yes, as was in my presentation, that is a good idea, but we have to find the right role of the pharmacist in the vaccination program. As András mentioned, that specialization in the medical care, it's a phenomenon nowadays. And of course, vaccination is a specialization because, as I mentioned, it's a complex decision. There are different kind of persons who need prevention on vaccination, different kind of health status that needs vaccination and in prevention. But for example, and I just give this example, the influenza, because the influenza vaccination is year by year, and all of the risk persons who are year by year vaccinated is the lowest risk about after vaccination complements or complexion. So this would be a first step to involve pharmacists in prevention and vaccination program.
Thank you, Katalin.
So I would like to mention two things here. First is that in general in Hungary, because of the pediatric vaccination scheme, which is like a very unique and very, very successful part of the public health system in Hungary, we are at a very good level in terms of the pediatric vaccination, which unfortunately is not the case in the case of adults, as it was seen from Ágnes' presentation. So here we do see a gap which can very well be filled in with some new approaches, and one of those new approach could be the vaccination by pharmacists or pharmacy-based vaccination, so PBI as we call it. I would also mention the access. I think if we are seeing on a systematic basis, the most important is that we have to make sure the easiest access to the people. And what is the easiest access? Probably beside the GPs, it would be the pharmacies, where they can where they can just like the first to go place for vaccination. And the other thing which I think is very important and where I do see a room for improvement in terms of the Hungarian healthcare system is the prevention. And it's not only the prevention in terms of specific vaccination, might it be influenza or any other, but it's just raising the awareness of self-care, raising the awareness of what you as individual can do for your own health. Mm-hmm. We are citing quite often, you did especially, citing quite often the fact like how much of the responsibility lies within the healthcare system, whereas how much lies within yourself or by your genes. But actually, a lot depends on you. And I think here, Hungarian society is quite weak. So this is something that we have to seek how to improve. And I think this might be a possibility that can contribute to this. So for this reason, I think we, on behalf of AIPM, we are very much pro-vaccination. In terms of either pharmacists or by pharmacists. Mm-hmm. But we do think that it's a good way of, or a good channel to include, to widen actually the access.
I've only just thought of this. You obviously, I'll come to you in just a second. I've only just thought of this, which is one of the things of overcoming that reluctance, particularly amongst adults, is having trusted sources of information. And apart from going to the GPs, most people will go to the same pharmacy and they will get to know those people. So that becomes another access for information and then spreading things like self-awareness.
Exactly, and that if you allow me, I would just remind everybody that we are doing this health literacy survey with the population, and after 10 years, we just did another representative survey about general health literacy issues in AIPM. And among the questions there was the question, who do they trust mm-hmm. in terms of healthcare professional? And we have to see that or besides the GPs is the pharmacists, where they go to ask questions, where they trust. So that's also very important, as you said, like we have to seek where people trust, where they see, where they believe the information, especially, I mean, we all see what happens in the US, we all see what happens actually globally, anti-vaccination coming up. We have to, I mean, those people who are on the grounds of science, we have to fight for science.
Well, we're also hammering in nails, so let's fight for science at the same time as hammering in those nails. Judit.
Thank you very much, and thank you again for the kind invitation. Of course, I'm always happy to be here and part of this kind of CEO breakfast. I think I make it a little bit a broader aspect, and not just on vaccination. When we are talking about the competencies of the pharmacists and the possibilities of the pharmacists, we have to define the pharmacists themselves, who we can consider pharmacists, because I think now the majority in this room are talking about those pharmacists who are working in an apotheke, in a pharmacy, in a town or in a village. But there are hospital pharmacists as well, with different possibilities and different competencies. I just had an interview 2 weeks ago in a journal, and they asked me why I choose to be a pharmacist, and I replied that because I thought that this gives us the broadest competencies in healthcare system that I can imagine ideally. So there are a lot of levels to be a pharmacist, and it gives us a possibility to have a lot of competencies. So first, I think we should find the exact role of the pharmacist in every level of the healthcare system. In my ideal world, the pharmacist is part of in a primary care system, is part of the praxis community and part of the praxis groups as well, with equal rights to the medical staff, to the doctors as well. And so I think it is very important on the primary level. And within this it gives us a possibility to be an active partner in the prevention program and on monitoring the patient's adherence and cooperation and everything else. So it's a very valuable and very important role as well. In the secondary level, I think now there are more and more competencies of the pharmacists in the hospital. So also they can be part of the defining personalized therapies to each patient. I really has been impressed by the presentation that just has been done at the end of last year in Szeged in the conference for hospital pharmacists. It was extremely interesting how high level they can manage their everyday operation in a hospital. So I think we have to define these roles, these competencies, and give the possibilities to choose, because they have to, I mean the pharmacists to choose, because they have to, it has to be a voluntary-based cooperation with the doctors and with the medicals. It cannot be obliged, nobody can be obliged to do that, because it's a really heterogenic society of the pharmacist society. There are different people with different interests, so I think it is also very important to highlight that it cannot be obligatory, it cannot be a voluntary-based cooperation. But if we give us a possibility to join voluntary this kind of GP association, GP network, or in the hospital, then it would be very fruitful, I think, in the future.
It's obvious from your answer that at least for you, there's already been a degree of thought that goes into this, into how might a system work and what are the challenges going to be. And it's always reassuring to hear that people in government are thinking. If we were to introduce a system, if we were to take the decision today to expand services into the pharmacies, and let's go for a broad definition of pharmacy and say not just in the hospitals but out in the towns as well. Realistically, how long do you think it would take to enable that system to happen? So are we talking about something that could only come into place in 18 months' time, or could it be sooner than that, or might it need to be later? And I do appreciate that part of the challenge in answering that question is it rather depends on what it is that you're going to roll out. But let's say it's just basic services. How long would you think it would take?
It depends on the services, of course, what we can provide. Just a very practical question. Will they part of the current logistic system, how now the vaccines are distributed, because it's based on a public tender, it's allocated by the authorities to every GP's office, and now it means it nearly needs to be doubled. Because if every pharmacist would like to make vaccination, how the distribution, maybe we can ask those experts here in the room with the wholesalers, how they can imagine how much time they need to manage this as well. But theoretically, the possibility can be provided within half a year. So it's not the possibility itself. But I don't know in everyday life when there is an availability in every pharmacist to have vaccination. I think it's more than 1.5 years. But the possibility can be created within half year.
The idea about it being voluntary is really interesting. I do know that the UK was one of those countries where during COVID, vaccines were administered, but there were a lot of issues around. Well, okay, if I give you the vaccine, then you have to sit down for 20 minutes while we make sure you're okay. And do I have the room for that? So I guess part of this would be: A, are pharmacists interested in doing it? Do they want to take on extra services? And I know that no one person speaks for all pharmacists, but broadly speaking, do they want to make that choice? And then if they do want to make that choice, do they actually have the facilities? And so you begin to winnow out people from the system right from the very start, which makes it.
And additionally, it has to be supported by the IT system, because then the GPs has to be aware that a certain patient get the vaccination in the pharmacy as well. So it has to be an online IT system as well developed.
I wanted to come to IT, but actually, since we're there now, it makes sense to do so. So clearly, pharmacies are linked to the cloud, and they're linked to doctors in that way. But I'm a business journalist. I'm not a pharmacy specialist, despite sitting here. I'm getting there. I know far more than I did 5 breakfasts ago. But is that a one-way connection? And if it's not a one-way connection, how do we? I mean, it strikes IT. Hungary is very good at doing IT. It's much better than the UK. And you do seem to launch systems that don't fall over straight away, which is a bit of a UK speciality. So is that an easy fix? Or do we have to go back to, well, hang on, there are no easy answers, because we've got to start by what is it that we're trying to do and then work out what we need for that.
Concerning the IT system, we already started to develop this kind of communication possibility between the pharmacist and the GPs, and the main reason for that is that we started to give the possibility for prescribing medication by pharmacists. And it, of course, it has to be covered by the IT system as well. So we're now working on and to implement a new system which gives the possibility for the two ways communication itself, so not just to the health cloud, but to give any sign to the doctors, for example, if there is some problem with the medication that has been prescribed by a specialist to a certain patient, and additionally to. It sounds very IT, but it's very important to create a record in the health cloud by the pharmacist. And this will be developed because of this prescribing possibility as well. And after that, we can just increase it and we can just wider it as we would like.
András, as a pharmacist, I was going to say albeit a hospital pharmacist, that's a really important thing to be. And bearing in mind that you cannot speak for everyone, what sort of uptake do you think there might be? Is this something that pharmacists would be interested in?
Well, I think the answer to that question is actually a two-pronged approach. Mm-hmm. First, it is just like Judit explained. It's the framework. Of course, without a framework, everything would stay in a pilot phase, and we would end up in a pandemic of pilots and early access, and we would, we would just stuck in that phase forever. So that it's hugely important to have the framework in place, but it's also a shift in the organizational culture or the mindset of the professionals and my colleagues in a broader sense. And what we saw actually, and this did happen in Hungary during the past, 6 to 8 years, and I'm not saying that it should take this long, but approximately 8 years ago, the British sense or the Anglo-Saxon sense of clinical pharmacy services did not really exist in our everyday practices. And a bunch of pharmacists started out to make this happen. And what we kind of did was that we really just set out on this mission, and we were really determined to get there, and not really taking into consideration the way how we get there. So of course we tumbled over some leftover boxes because we were just looking really slightly upwards. But still, eventually we came to a point when it is actually a sexy thing for a hospital pharmacy to offer clinical pharmacy services. It actually has a value. from the professional sense of enablement, in being enabled. So I think that is the other part here. And yes, technically the framework can be fixed in a couple of months or a year maximum. There will be a guidance document happening, there will be some legal changes happening, and then it will become the point when we will have to just scale up this whole thing and make it sexy for pharmacists. I'm 100% sure that within a year or two, this will be the next big thing. Because our colleagues will eventually realize, and even pharmacy owners will realize, that this is not only an added service, but a value-added service. So it will most definitely not only pay for itself in a financial sense, but also from the recognition part, and it is the part of the reprofessionalization of the profession.
And that's really important, that people have perceived value in what they do. And I guess that would be one of the reasons. I had asked I had a potential question earlier, which was, what's the driving point? What's the main thing we want to get out of this? Is it to raise esteem for the pharmacists, to give them more work to do? Is it to spread the workload? Is it actually just to look after healthcare needs? Sorry. And I guess the truth is that it is all of those things, and that there can't be any one primary thing, because they all work hand in glove.
Yes and no. I think that if we kind of get comfortable with that thought, that it is such a multifactorial thing, then we will just end up waiting for the other stakeholder to move, or the other aspect of the situation to move. So I always have this example in my mind of Croatia. They really were reluctant from the governmental point of view to introduce the euro as a currency to the country. And eventually the people itself started to use euro regardless, without the actual financial and legal aspects in place. So it was actually one solution when the practice was going forward and legislation had to catch up. So I think whoever has that internal motivation should just go for it and let others follow.
Thank you. Ágnes, you wanted to say something?
Yes, I would like to add another angle to this, that the goal is the healthy population. And we are facing nowadays with the time of the aging, because we have longer lifetime, and as Kata mentioned, that the prevention and the vaccination program in childhood is working very well in Hungary, but adults are completely lost in this question. And of course, not only the vaccination, but the screening and advocacy of the screening, or advocacy for other preventive measures for a healthy, longer life is a very important question in the primary care, not from the general practitioners, but the pharmacist as well.
If I may, I would just add on one aspect. Vaccination is very cheap compared to other treatments, compared to actually treat already existing conditions. Vaccination is extremely cheap. So you have to see this financial aspect as well. On the other hand, when you were asking about like what is the most important aspect in this, I would say patients first. So the first and foremost importance is to contribute to the health of the population, which we all know that vaccination contributes to us. So that's the first part, and that should be the most important part. The other thing is like, as all the aspects that you mentioned really shows that it's a win-win-win situation, because it's also very important that we have to give responsibility to pharmacists. Hungary is traditionally strong in terms of the pharmacists and in terms of the pharma, but we have to keep this value. And how to keep the value is to elevate the responsibilities, to show that these people are valuable system of the healthcare. They are not only salesperson in the pharmacy. So that's also very important. And we see that in other places, in other examples. UK Pharmacy First example is a very good example for that. Of course, it's not only about vaccination, but vaccination can be a good pilot. I'm afraid to say this, but it could be a good pilot for this. Yeah.
Judit, I could see you twitching at the phrase "vaccination is cheap."
Yeah, I had a tweet on cheap. Yes. No, I have to challenge it a little bit because, of course, one vaccine is quite cheap. It can be quite cheap, but the vaccination can be only successful if it is population-based. And when we are talking about the population-based vaccination, I wouldn't say cheap. I would say it may be cost-effective, but it's definitely not cheap. Just to.
I agree. In record, I agree.
Duly noted.
Thank you. Noted. Yeah, noted. So that's the most important thing. And I just wanted to add that I think there are lots of competencies of the pharmacists which are not used currently, and this can be a very valuable possibility if we can provide them possibilities to use their competencies. Those, of course, voluntarily, only those who want, but give them the possibilities.
There's a very obvious, I wouldn't say it's an elephant in the room, but we've started to talk about costs. And clearly, if we are going to add pharmacists as a vaccination point, you need more vaccines. There's more cost there straight away. Does the system, as it currently stands, have the possibility to find enough money to extend these services? And if not, where does it come from? Or do we begin to have to play with the idea of maybe looking at a different finance model for pharmacies specifically to roll this out?
It's a very difficult question, of course, to answer, because I would ask everybody to have a bet that figure that has been presented by Ági in the presentation, the level of the average vaccination income in influenza. What would it be if there would be a possibility in vaccination in pharmacy as well? And I don't think it will be over 80% or 70% still, because there is a huge difference between the vaccination, as Kata already mentioned, in the childhood, so the childhood vaccination scheme, compared to those that is a little bit different. I wouldn't go into details, but the efficacy and effectiveness of different influenza vaccine and when we can really gain on using this vaccination and how it will save, how much money can it be saved in the healthcare system. But I think the income wouldn't be more than 40 or 50%, so there will be a very limited increase in the level of vaccination. That's why I always try to highlight to broader competencies to the pharmacies and give a strong possibility for the patient care program in the pharmacist altogether, not just vaccination, but altogether the patient care program, because this has a major value than just the vaccination itself.
Kata, do you have any view on how it should be paid for?
I wouldn't dare to say anything how it should be paid for, because it's definitely, we are on the other side in this.
That's why you're here.
But of course, I do have opinion on this. all in all, the thing is like everything, when you want to pay for something, it will not be cheap indeed. What you have to see whether it's worth it or not. And I do believe in vaccines in this sense, and I do believe that it's worth it. Of course, and I wanted to mention this before when you were asking about rolling out this project. I wanted to mention that whenever, like within the professional discussions, we were talking about a pharmacy-based vaccination, it always starts with a pilot. It always starts with a smaller group of pharmacists, with a smaller group of, like on a project base, and then we can see the effectiveness. We can see how much it really does increase vaccination within the population, whether it does or not. So we have to measure it before we roll out to the whole society. But I know, and András is actually the key expert in this, they already do have the plans, the methodology, how to roll it out, the different steps, the different tiers, how to achieve it, and to measure back at each steps.
We'll come to you in a second, András. Ágnes, do you want to add anything?
Yes, just an adding thing that, as Judit mentioned, a broader services of the pharmacist, not only vaccination. So in these services, we can differentiate what will be a free of charge service, what will be a charging service. So we can just make a cost-benefit measure and decide how to go on and making pilot programs for it. Yeah.
Just to follow up on that, forgive me if it's a silly question. When you make a difference between free of charge and charged for, where does that money go? Would that, in your mind, would that money go directly to the pharmacist, or does that, or is this something that somehow gets back to the health funds?
I'm not in the position to just make a decision on that, but in my mind, it goes to the pharmacist. Yeah.
Okay.
Sorry, just one remark here, but I'm not the one who should be taking these remarks. I'm sorry you did, but you have to know that also in the case of GPs, there are vaccinations which are free of charge and some vaccinations which you have to pay for even at the GPs. Yeah. So there is a practice actually for that, but it's also an aspect that we have to see or that when the whole system is set up, that we have to consider how is this related to the level of finances that the GPs get for vaccination and what is happening in the pharmacy. So that's also an aspect which have to be considered in order to ensure the balance between the GPs and the pharmacists. This is just another aspect that makes it even more complicated than as it is.
Because why would we not make it more complicated? András, so there are plans, you have ideas of how you would roll it out, and perhaps more importantly, how you would, not plans, ideas, and how you would pay for it.
Well, what we have is, I have another role in the so-called European Association of Hospital Pharmacists, of which I am the immediate past president of. And with the AHP, we actually had a task in collaboration with the European Medicines Agency to create a summarizing document about pharmacy-based immunization within Europe. And that was done in conjunction with PGEU, the pharmaceutical group of the European Union. So even a white paper was published on this, and also the International Pharmaceutical Federation, FIP, has a white paper not only towards pharmacists on how to introduce PBI programs, but also to legislators. So there is basically a rule book or a kind of a clear path or a recipe or even a checklist on what to do and what to take care of if we want to introduce such a system, both in terms of guidance, both in terms of SOPs, in terms of screening for eligibility of the individuals, but also for the remuneration scheme. What we see, and we kind of have an ongoing conversation with Judit about this for, I don't know, like 5 years now, about how to reimburse clinical pharmacy services, even if it's a possibility at all, or even if it should be reimbursed, that's a valid conversation to have. But I kind of see the reimbursement of pharmacy-based immunization getting into that field of conversation. From where I see it, I would really refrain from further fragmenting the reimbursement mechanisms we have. It's much easier to somehow use the pre-existing routes that are in place, because otherwise we really have a chance to scale up noise and not only services, if that makes sense.
No, that makes sense.
So from where I see it, and from the example of many European countries, the most recent of them is Slovakia, who introduced pharmacy-based immunization just 1st of October last week. Almost all of them started out in a fee-for-service model, where during the first phase of rolling out PBI, it was actually an out-of-pocket payment from the citizens, from the patients themselves. This way, they really did not have to overcomplicate the already complicated situation of setting up the legislation scheme. And then it was a next step, if and how it could be integrated into the pre-existing models of delivering influenza vaccination, for example, through different routes of reimbursement. And honestly, and probably this is my last thought for this part, I really think whenever we think of public funding, it should only be allocated to outcomes. So we as taxpayers should only should pay for outcome. And in that sense, let's not call it a pilot, but probably in the first phase, it could be a fee-for-service model. And if it becomes part of a more complex longitudinal pharmacy care or pharmaceutical care program, that could be more based on outcome and linked to the public funding angle. And now I'm afraid to look at you, David.
No, I just wanted exactly to raise this kind of question, that what we need to pay for. So it is an extra cost, because when we are talking about to find money to finance the vaccine itself, I think it's out of question that we can find the money for that. But if we can find additional money to the service that's provided through a vaccination, it's an extremely difficult question. And this would be very difficult because there is a total different financial scheme for GPs and for pharmaceuticals. For GPs now, there is no need for extra benefit because it's part of their financing anyway to vaccine those patients who are eligible for the free of charge vaccination provided by the NNJK. But in pharmacy, what will happen? Because it cannot be free of charge because it's not part of their income, but their income comes from the from just the wholesale, just the final share that is done by given by selling the medication. So it would be a very difficult question how we can find money for an extra service and not for the product itself.
Thank you for that. In a second, I'm going to open it up to questions from the floor. So if you don't yet have a question, now would be a good time to think of one. I just wanted to circle back to something you said. So wearing your European hats, I was struck by one of Agnes's slides that there are some countries that have nothing to do with extended pharmacy services, and some that are that very much do. And I think was it Ireland who go back as far as 2008. Wearing your European hat, is this the direction of travel for pretty much everywhere in Europe? It's just some people are at a different speed. So do you imagine that these extended pharmacy services is what you will let's say in 5 years' time, you will probably find everywhere in Europe. So, and if that's the case, Hungary needs to step onto that train before it disappears.
Well, what is obvious is that more and more countries in the EU are actually offering this kind of service. So it kind of is already happening. So obviously that's the way things are developing. And again, I would really try to generalize this a little bit, since it is not only PBI by itself, but it's more of the so-called longitudinal pharmaceutical care aspect of our expanded services that is growing. And historically, it's been much more advanced in countries that developed under the influence of England and the US, basically very well after the First World War. And all the countries which developed under, and I'm not saying only development of healthcare, but also how actually the society is constructed, how our legislative system is constructed. So all those countries that developed under the influence of Germany, they have a bias towards the more traditional roles of pharmacists. And this region where we sit seemingly lags behind in that angle. We are more geared towards production for pharmaceutical technology, in-house compounding. That was more of our cup of tea. There is a convergence now. Of course, a large portion of compounding and even compounding of sterile productions has been moved to the pharma industry. So it is kind of an obvious change that we are moving and gearing more towards direct patient care. So in that sense, I do see this development happening, yeah.
Thank you. Ladies and gentlemen, we've talked quite a lot, as is our wont. Are there any questions from the floor? Sean, let me give you the microphone.
So, first off, thank you. I think it's a very important topic and a very interesting perspective from everyone on the panel. Maybe just for full disclosure, so I'm the managing director for MSD. We clearly have a very strong position in prioritization around vaccination, so we believe in our business is very important. So just to give a little bit of context to the question itself. I wanted to follow up on one point. I've experienced myself, both in many markets, including the US, very early on evolution of this model, and have experienced it as a patient myself and how it works and the benefits it has. And I think a couple of the points were made. I've seen it reinvigorate the pharmacy field employees, by adding, services that are beyond their kind of day-to-day. So I think from an employee perspective or other, there's a lot of benefits to that. I think the clear public health benefit is something that we talk about very openly. And I would say it's our responsibility as companies to demonstrate cost effectiveness. So we take that on and we do that regularly in our conversations. One question I had was the last point, and I'm interested, maybe András, your perspective first, and then if Judit has something to add. You talked about like the fee-for-service up front, and if we were just to focus on vaccination, and I just use influenza, for example, as a starting point, do you foresee a model where we could do a fee-for-service and the only thing you're charging back is the vaccines, and the extra services are not something you're charging back? Because, again, as you probably can understand, as you're getting more people into the pharmacy, I think it's also clearly demonstrated that they're also doing other things or making other purchases or actually gaining more services. So there's obviously incremental value there. Because I think to the point of really moving forward and implementing this is important. And so if you simplify it to that, there may be more receptivity to do that moving forward. So I'm just interested in your thought around just really the fee charge back would be the vaccine itself, which Judith's referenced, and is there a possibility not to focus on additional services beyond that to start?
Thank you, Sean. We like full disclosure. András.
Thank you very much. Yes, there are already models within the EU that use this almost co-payment type of approach. If I'm not mistaken, Poland is the latest addition to that group. So actually, the vaccine is prescribed and it's reimbursed through the usual reimbursement scheme, and then it's only the service that is paid by the individual. I definitely can see that happening. Of course, then we come to the technicality that who is prescribing the vaccination. Does the patient have to go to their GP first, or at least notify them to get that prescribed in the cloud or anything? Again, if I close my eyes and imagine a beautiful, ideal world, it would be the pharmacist who prescribes it independently. But probably that's more of a heresy to say out loud these days. But yeah, I do think that is bound to happen. Trying to look in the future, I'm not seeing the type of acceptance that probably you have in the US. So curbside vaccination is not something we are looking at in the near future, albeit that would be awesome. But yeah, I do see that model as a viable option.
Judit?
Yeah, just to add something that maybe we can ask a survey within the patient, because there are currently reimbursed vaccines which are available in the pharmacy, and ask them, would it be an added value if the use of the vaccination can be done in the pharmacy immediately? Yes, because those vaccines that are currently reimbursed, so not with 100% but with a certain percent, 70 or 90% reimbursement, can be administered in the GP's office for free. So the patient already has to free for then a certain amount. This can be also applied in the pharmacy if there would be the administration would be held in the pharmacy itself. But it's a totally different story if there is a freely provided vaccination, which, for example, influenza above 65, age of 65. It's a totally different story because the GP cannot ask money for the administration, for the service. It means that if the pharmacy would ask money for, then it would be an extra cost. But as again a pilot or the first phase, we can manage it in the same way, because if already a patient get the vaccination for prescribing it, they are aware that they should also pay for it in the GP's office as well. So we can give the possibility to do it in the pharmacy as well. This can be somehow the source of financiation as a first phase.
Thank you, Judit. Any other questions? Yes, sir. Just bear with me one moment. Please remember to speak into the microphone. And if you could identify yourself, that would help.
I'm Robert Wagner, and I need to join Robin Marshall. I'm neither a pharma expert. I'm a medtech guy, so I will bring another flavor. This is the patient. There was very few words about the patient. Coming here, I had a phone call with my grandmother, and I told her there is a discussion today if we should expand the role of the pharmacist. And she said, tell them yes. I said, why do you say this, grandma? Because I have a pharmacist in the village, but I don't have a GP. So taking the joke away. For me, from a patient perspective, there are three important layers. One is awareness. The population healthcare awareness needs to be increased. And the information shouldn't come from the social media, but it has to be a structured part of the educational system. It's not the case. Second is we have to rebuild the trust in healthcare and in the healthcare service, in the physician and pharmacist. This is political will. And the third one is capacity. Today, what we already touched with my grandmother, we have an increasing aging population while we have a decreasing amount of GPs. So I'm a physician. Honestly, it's completely irrelevant of pharmacist or physician. We need to use these both very important resources that we are able to somehow cope with the increasing demand. And I think what one of my bosses in the past told me, I don't care how you organize yourself. You simply need to make it happen. Thank you.
Yeah, words to live by. I don't care how you do it, just make it happen. Panelists, do you have any thoughts to that? Kata, let's start with you.
I'm not responsible for making it happen. Whatever AIPM can do to set grounds for discussions, we are doing this, and clearly it's very important to our member companies, and it's important for the patients, as I started with. So we are very much pro pharmacy-based vaccinations, but I do think that it's not my responsibility to say that we need to do it now, because there are certainly many things that we need to do now, and I'm afraid there is not enough capacity to do everything at once. But I really hope, and we were discussing this last October, I think, when we had an event about this, where actually all of us were present. We had the approach that it would be the best to make it happen as soon as possible. But I would say that the closest is Judit to say whether it would be happening soon. So,
Judit?
Yeah, sure. Well, again, I think it's to give the possibility, and I never challenge the grandma, because grandmas are always right. But I think in those villages there is no GPs, which of course not possible, because in every village there is a GPs. Currently, maybe it's a substitution of a permanent GP, but still there is a GP. If there is a pharmacy nowadays, based on the regulation, I'm not sure if a pharmacist are there or just an assistant. So it's a little bit difficult, but again, we should define our expectation, what we can expect on that. And maybe I know personally lots of pharmacists, since I myself am also a pharmacist as well, who would never administer an injection to anybody, because that's why they choose to be a pharmacist, not to touch the patient. But just, so I think it can be a difficult things to manage. But again, the possibility, if we provide a possibility, it gives them really the situation when they can manage it. But we should identify our expectation, what we can really expect on that, and it can be articulated very well that it's not for in every pharmacy, not for everybody, but it just gives them some possibilities.
András, did you want to follow up on any of that?
Yeah, it's kind of a confession I have to make, and I already made this confession to you, so probably I'm not going to jail for this, or not for this, but actually, when it was still the COVID times, and it was hospitals who had the vaccination centers all around the country. Actually, we have 25 pharmacists in the hospital where I work, and I asked all of them if they would be interested in doing vaccination, and I don't know, like three quarters of them said yes. So we created an internal SOP, we created a very short training for them, and actually it was pharmacists delivering vaccination. I received all of my COVID vaccinations from pharmacists in Budapest in 2019, or in that vicinity. So actually our purpose was not to circumvent the system, our purpose was not to get in jail, our purpose was to prove a point, and to create a proof of concept that it actually can work. Pharmacists are actually, they do exist who actually want to poke people with needles, which is weird. And that with a very short training, both technical and also theoretical, but it wasn't longer than half a day. Of course, with a bit of clinical background, but still. It worked, and no one died. So, yeah.
No one that you'll admit to.
Not because of vaccination.
Not because of vaccination. So I fully understand where your grandma is coming from. So, yeah, let's do it, and let's just fix the details as we go.
Ágnes, did you want to add something?
Yes, thank you. So you are broadening the aspect of all these questions from the population education as well. And not only Hungary dealing with this question, but other European countries is dealing with that. How can we make healthcare system more resilient, and how can we just strengthening the primary care? Because as I heard from other countries, that every medical student wants to be a brain surgeon. So no one wants to be a general practitioner, or no one, or no, not no one, but less less part of the medical student wants to be a general practitioner working in the primary care. And this is the question nowadays: how can we strengthening with medical doctors, with the pharmacists, and with other healthcare persons to give a good service or good primary service for the patients, not only in big cities, but in the rural areas or in a country.
Thank you. We have time for one last question. Is there anyone? No one? A message from our sponsors.
Actually, more a comment than a question. So first of all, Judit, I don't think that the logistics of the vaccines will be an issue.
Thank you. It means you will provide it free of charge. I'm so happy with that.
Thank you for sharing that.
But maybe we started to talk about community pharmacies, and there might be more complexities as now discussed. You mentioned that a lot of pharmacists are not ready to give vaccines. I also believe that, and you also mentioned it, that vaccines alone is not a solution. We need much more services in the pharmacies, because there's one thing which is important. If you ask patients what they want, they say, we don't want to queue. So while the pharmacist is giving any kind of treatment, he cannot dispense. And this is an issue. It's a question, is he paid? So if I give additional services, I cannot dispense, I cannot serve other customers in a pharmacy at that time. So is it expected that the community pharmacy is doing this with given resources, but then they might lose patients because there are competitions between the pharmacies? This is a problem. And this is something what we have to face. And if we have the examples from other countries like UK or the Netherlands, and where this is working very well, they have a complete different history of refunding funding services to the pharmacies. So I think, you said it well, we have to start with pilots, and let's see how this is developing and learn from this.
Thank you, Wolfgang. Just in case anyone doesn't know, that's Wolfgang Wallace from Phoenix Pharma. Does anyone want to pick up from...
Yes.
Yes.
Definitely.
Oh, yes. You're in trouble now, Wolfgang.
Well, I agree, and we didn't touch upon the thing, but it was highlighted, I think, in the first round maybe, that pharmacy should provide possibility, of course, for vaccination as well. And I mean in physical aspects, so there should be a room, there should be a separate possibility where patient can sit down, and the other I wanted to add, we did not raise, but maybe we can have a common ground on that it should be linked to a license to a pharmacy. So not just for everybody, but at least who had at least a 2 days program to manage to get a license for vaccination as well, and then at least we will have a knowledge who would like to use this possibility and who would like to get this possibility. And additionally, of course, we have to define those basic criteria that should be met to get vaccination in the pharmacy as well. So that with these two assumptions, I'm fully agree that maybe there will be an in-house competition between the other patient and the vaccination, but on other primary care program as well, and then again the pharmacist will have the possibility to choose.
Maybe just a very short remark on other international examples is that it can also happen with a dedicated time for vaccination. So it doesn't need to be in the general opening time of the pharmacy. That's also a possibility. So I think that there are, since we are not the first one who would like to do it, I think we have to rely on the international best practices. And there are best practices, even, for example, when we were talking about finances, when we are thinking about how much patients should pay when they are using it as a fee for service, then we know it's approximately 10 euros in all the surrounding regional countries. So we do have best practices. We don't need to reinvent the wheel, basically.
Agnes, would you like to add a last thought? No? András.
I'm just amazed that a Phoenix truck is right out of the window. Such a product placement.
Yeah,
right?
that's attention to detail.
And you were asked to highlight it.
And they are bringing vaccines right away, just to make it happen now.
In that case, ladies and gentlemen, I think it's probably time to wrap up. So what have we learned? Well, we've learned that the most important thing is to actually, we've learned that there is a European trend that is going this way. We've learned that one of the key things before you go any further is to actually work at, and that sounds such a silly thing to say, but you have to understand exactly what it is that you want to achieve. And then you can begin to build a framework for it. We've learned that András doesn't like the idea of pilots or pilot soup. So let's build that framework. That probably what is already happening is that bodies are getting together to try and ascertain how you do it, where you do it, and then there will be, as Kata says, there are other opportunities, or there are other examples out there from which we can learn. It's not that Hungary has to do this in isolation. Surprised to hear that the Anglo-Saxons have managed to do anything right, because that doesn't seem the way it works in recent years. But there is an Anglo-Saxon approach to pharmacy, and maybe that's something that needs to be developed. Phrase I didn't think I'd hear today was curbside vaccinations, which would be awesome, I believe was the quote. So there are many ways this could go. It could be a very narrow frame or initial first phase, not a pilot. It could be a very, very narrow, or it could be very broad. Obviously, pharmacists themselves have to be willing to participate. And then perhaps they can, along the way, help us restore trust in healthcare where it is needed. Keep grandmas happy, because obviously that's the most single important thing that we will take from this meeting. So, ladies and gentlemen, I would like you to thank Dr. Judit Bidló, Deputy State Secretary for the Professional Management of Health at the Ministry of the Interior. Dr. Katalin Szalóki, CEO for the Association of Innovative Pharmaceutical Manufacturers, Hungary. Our keynote speaker, Dr. Ágnes Galgóczi, Director of Prevention and Epidemiology at the National Public Health Centre. And last but very far from least, Dr. András Süle, Chief Pharmacist at the Péterfy Hospital Budapest.